And Joan asks, what is digital quality measurement?
Great question, Joan. Medicare introduced this term into the vernacular in 2022 rulemaking. Or well, I should say rulemaking for the 2022 performance year, which of course happened in 2021. It was introduced in the context of a view of Medicare's intentions at this time or at that time, I should say, for quality measurement. There's been a lot of misperceptions generated by that introduction. It didn't actually, the term hasn't been used in any rules or rulemaking or options that are available. And at the NACO's conference the fall of 2022, a spokesperson for CMS, that is Molly McHarris, described the concept as signaling a CMS intention to embrace quality measurement that incorporates a wide variety of digital sources, not just EHR data. Think remote monitoring. Think a direct capture of patient input. It's it's a descriptive concept. It's not a measure type like web interface ECQM or MIPS CQMs. Now, and it doesn't even signal the intent to close off any manual input into MIPS CQM reporting. I would gather from other comments that long-term Medicare would like to see us move entirely to digital digital measurement, so that we're not relying on any manual abstraction or overwriting of any data. I don't see that coming very soon, because they also have a goal to make reduce the burden of measurement and continue to support small and rural practices that that can't be as quick to digitize all their data as others. And as a qualified registry, it doesn't concern me much either. If they reduce manual inputs, it'll reduce the number of different data sources we will be obliged to maintain. Certainly, we already maintain all those electronic sources that are available and typically needed for any of the MIPS measures. So now, as you look at the various types in existence now, all ECQMs are digital measures. They come from EHR. They have to come from EHR, but not all digital measures are ECQMs. In fact, it's difficult to think of remote monitoring, particularly in early stages of remote monitoring or patient input data, necessarily being in certified software. There's a lot of things that occur that they're not certified or won't be on the certification list for quite some time. So I think that is a commitment to continue alternatives to eCQMs. In fact, as Medicare introduced the subject of digital quality measures in the context of a view of the future, that future view acknowledged the inclusivity of most EHR-based measurement and the difficulty in getting that data together, and suggested that they knew they were committing to a process outside the EHR that tends to bring the data together and bring multiple data sources together into a common measurement platform. So I think you can count on eCQMs and MIPS CQMs, qualified registries, eCQM vendors to both be around for a long time and to evolve as the system demands evolving. Whether that evolution will converge them into a single concept is anybody's guess, but a reliable source of, if you found a reliable source of measurement, there's no reason to expect Medicare rules will sunder you from that. In fact, with the existence of the APP, it's really spread it out again and taken it out of the sole venue of manual chart abstraction.